A new COVID variant rattling investors, and that variant has Asia and Africa on high alert. This as health officials overseas are warning of the latest strain, possibly showing enhanced transmissibility to evade the current vaccines on the market. Now, Paul Tilsley joins us from South Africa with more. Paul, what are you hearing about this newest variant and the concerns within the medical community?
Well, thanks very much, Joe. And here's the situation. 93 people have been found here in South Africa to be infected, 4 in Botswana, where the variant was first detected, or the first news of it came earlier in the week, and 1 in Hong Kong, a person who had traveled from South Africa. But is it a South African strain? As it now appears, there's an infection with it in Belgium, in Europe, in a person who has never been to South Africa. Analysts here saying it's unfair that because South African scientists are good at evaluating new strains, good at their technology, the country is then blamed for the variant, which may not come from here. And in the last few minutes, Joe, the South African Health Minister, Joe Phaahla, is claiming many are making a draconian reaction to the initial research findings scientists came out with. The minister has poured cold water pretty much on everything people are worried about. He says research now has yet to show that the new variant is more transmissible. He's also expressed confidence that vaccines work against the new variant. He got quite excited with journalists, saying to them phrases such as "no such, no indication," and concluded that there's no evidence to suggest this is serious. And he has accused countries who've banned South African flights as going completely against the norms laid down by the WHO. In the US, National Institute of Allergy and Infectious Diseases Director Dr. Anthony Fauci, who you know, has said this morning that he's talking to South African scientists here a little bit later in the morning to really get the facts. There's even been a suggestion, Joe, that the scientists will be providing live data to help Dr. Fauci with research in the US.
Well, to that point, Doctor, I bring this up because we saw in Sweden how they effectively, kind of absent of science, started banning fully vaccinated people from Israel, even after they tested negative for COVID, from entering the country because of breakthrough cases. We now see what's happening in South Africa, where, to your point, there is little indication this variant will be any different from any of the other variants. It seems to me that every virus mutates. That is effectively what viruses do. Is it irresponsible, almost fear-mongering, for people to rush to judgment before we again do what people have said we should be doing from the beginning: trust the science, follow the data, and make informed decisions that are in the interest of the public health, not in the interest of the political gamesmanship?
Yeah, absolutely, Joe. You're absolutely spot on. Look, we have a really well-respected, internationally respected government research institution here. And by the way, I'm no fan of the South African government, but this is not a political organization. It's called the National Institute of Communicable Diseases, or NICD. And today, it's expressed a call for caution. It's backed up what you're suggesting. It's saying the virus has not fulfilled the WHO criteria for either a variant of caution or a variant of interest. It says this will be revisited, especially as the virus spreads and data is accumulated. And the NICD claims, here's a big thing, Joe, no one who has the new variant tonight is feeling more than mild flu symptoms with this variant. No one's seriously ill. No one's in hospital with this new variant yet. And so they say, and I quote, currently no unusual symptoms have been reported following infection with a B11529 variant. And as with other variants, some individuals are even asymptomatic. In fact, in other words, if they hadn't happened to be tested, they wouldn't know that they got it.
Right. It's really crazy. And I remind people here at home in America, the CDC is not even tracking breakthrough cases unless that breakthrough case results in a hospitalization or a death. Dr. Paul, as always, my friend, good to see you. Thank you so much for your work. We'll talk to you again soon.